Hello, everyone.
And good evening to you on another Tuesday night.
Yep, another Tuesday night. I'm trying to get our vitamins straight. Who struggles with that?
Well, I don't. Not
And
anymore.
not anymore for me either, because sometimes you have to learn the hard way. And so tonight we want to talk about calcium because this one is definitely an important mineral, and there's some specific nuances that you should know about it. And so we thought we would just chat a little bit about calcium, what it does in the body, why it's important, and for us as bariatric patients, why we need to supplement.
Well, I was a kid and I was always taught drink your milk. It has calcium and it builds strong bones and teeth, right?
There
So
you
we were
go.
taught that, right, of course. But there's a lot more that calcium does in the blood, the bloody in the body. It's involved in blood clotting. So without adequate calcium, you may struggle to have your blood clot normally. And clotting of blood is important, of course, for injuries and all kinds of things. Um, it helps to send and receive nerve signals. So the ability for you to move your muscles and for you to have your heartbeat, etc., is all part of calcium use. Um,
Those are pretty good uses.
and it's also involved in releasing hormones into the body. So the body has all kinds of functions that are controlled by hormones. I mean, the common type of hormone you might be aware of maybe is, thyroid or insulin or maybe estrogen or testosterone. But there are literally thousands of hormones in the human body that control functions, and they're super important. So
Why, as a bariatric patient, are we particularly at risk for it?
well, the reality is a couple of things. So, first of all, we have less acid in our system, so we have trouble breaking down some of the bonds, the
Because
chemical bonds.
calcium is a hard molecule.
And so, those chemical bonds, when not broken, prevent that molecule from being absorbed. Okay, that's
So, lack of stomach acid.
lack of stomach acid. Another one is the fact that bariatric surgery patients tend to have a decreased absorption of the fat soluble vitamins like vitamin D. And so vitamin D at a lower level inhibits calcium uptake as well.
Correct. And in bypass, the part of the intestine that primarily absorbs calcium is
Is no longer
offline.
online, right? It's offline.
So, and I feel like there's plenty of bariatric patients who have a relative dairy intolerance as well.
Oh,
So we're really
absolutely.
not drinking the milk.
No. I mean, and if you didn't have a dairy intolerance before you had surgery, so many patients report that they have a new dairy intolerance after certain operations. So,
Yeah. So here's the thing about becoming calcium deficient. It's not going to show up on your labs in on the regular panel called the CMP, where it has the actual word calcium, because our kidneys regulate that blood calcium to keep our hearts beating. So when we're talking about how we test that we're getting inadequate calcium and things, we need to look at a test called parathyroid hormone, or PTH, because when PTH goes high, it means that there's being bone is being turned over to get calcium into the blood.
well, let's back up for just a second. So, it's extraordinarily important to the human body to have calcium regulated within a very tight zone. And to keep it within that tight zone, it's going to borrow from your savings account. Your savings account is your bones. And so, as long as there's a deficit in intake or absorption, you're going to continue to borrow. And that's where the thin bones come from.
Yeah, and it's like when we talk to new patients and they read online like, "Well, I'm scared about losing my teeth and breaking bones."
Right,
It's like, well, our patients don't have that because we teach them and we educate them and they take
right.
the appropriate supplements. But basically, there's a couple of things when it comes to your to supplements. Number one, you have to be getting some labs done on an annual basis because you need your vitamin D status checked. You have to have adequate vitamin D. Otherwise, you're taking calcium and it's not being properly absorbed, and there's where we get things like kidney stones and plaques in the arteries. So, vitamin D has to be optimized, and for my patients, I like it somewhere 40 to 60. The 30 threshold is too low. We have to check parathyroid hormone because if the vitamin D is optimized and parathyroid hormone is still high, then we need more calcium than we're currently taking. So that's kind of how we know. First, if the parathyroid hormone is high, we need to optimize vitamin D. If it doesn't come down, then we need to optimize calcium. The other thing we need to know about calcium is that the form matters for this. And there's all kinds of different forms of calcium, calcium carbonate and calcium malleate and all these different types. What we really are looking for is calcium citrate because this is the calcium that breaks down in a low acid environment, and that is what we have in either sleeve or bypass. Uh, we recently at Building Blocks developed a premium absorption calcium called CalMag Absorb. This is what Bob and I take, and its benefit is that it contains some stomach acid in it. It also contains a ratio of calcium and magnesium of 1 to 1 because listen, calcium doesn't work by itself. It needs magnesium in order to fulfill its role. So, and studies show that a 1 to 1 ratio of calcium to magnesium is best for absorbing all of it. So because of that, we're able to get away with less pills because it's made for optimum absorption. And in my people that I test, I always see decrease in parathyroid hormones when they make the switch from the prior calcium, which is if you're taking capsules, 3 capsules twice a day, to the CalMag Absorb. However, if you are somebody who needs an increased dose of calcium, maybe you need more than the 450 that's in the CalMag Absorb, then you might have to do a combination, 1 dose of this and then do some extra calcium citrate on the side or something because taking multiple doses of this could give you too much magnesium. This is designed for 3 tablets, 1 a day, and they're tablets. They're quite small.
And they're smooth edged,
They have
so
a
they go
slippery
down.
coating.
Yeah,
I think they're great.
yeah, they go down nicely.
And for anybody who doesn't know that magnesium is like the magic mineral, it helps you relax and helps you stay calm and uh, is just great. So it gives you a 2 for 1. So that's all I wanted to say about calcium tonight. Did you have anything else you wanted to add?
No, I mean, I think we really covered out the basics.
Anybody
And
have any questions? I know there's only a few on here, but if you do have questions, please feel free to post them after the live is posted and we can answer them there too.
all right, well, have a great evening, everybody.
Enjoy the rest of your night.
Take care.
Bye bye.